Good afternoon. We're going to try and wake you up and do things a little differently. The two of us are going to do this jointly, and we are both at a kind of a similar level, working in a health center, and we're both healthcare providers.
Yes.
And we've been doing some peer-to-peer learning, and we're on in the middle of the night together. And a mother brings in a baby and gives it to me. And I see that the baby is having these movements. And I call, Dada, can you help? It looks like this baby doesn't look well. Can you see what might be wrong with this
Can you
baby?
please sit down? Okay. So I noticed that this baby is convulsing.
Isn't it? Maybe it's just jittery.
Well, let me hold the hand,
Oh, okay.
and I see it continuous convulsing. And you know, when we were doing helping babies survive,
Yeah.
they told us that if you see a baby's hand moving like that, and you hold and it continues, that's not jitteriness.
Oh, yeah.
That's a convulsion.
You're right. Maybe we should assess the baby with prisms. Should we do that?
Yes, I think so, because I last managed a baby like this about
Because I'm scared. This mother is
about 3
scared.
weeks, 6 months ago. I don't remember actually how to effectively manage such a baby.
Well, they kind of said if it's a seizure, we need to give some injections. I think they said phenobarb. I haven't seen a baby like this for 6 months. Have you seen one lately?
No, that's why I wanted us to really be able to show how to manage this with prisms.
Not showing up. Just talk about it.
Okay. So, okay. So you're going to keep assessing the baby, and I'm going to use my prisms
Okay.
to do this.
Okay.
And
Yeah, it's showing up now.
yeah. So do you remember the patient's ID number?
15468.
15468. Okay.
That's what the mother gave me.
Okay. So
It's still
date of
seizing.
birth?
Hurry up.
Yes, we need to do this quickly.
She told me he was born on the 7th.
On the 7th, okay.
Of June this year.
Okay.
And told me it was a term baby.
Okay.
And the weight, the mother didn't really know, said was normal. So she kind of said like 6-7 pounds.
Yes,
So
but I see that it was weighed.
Okay.
Okay, so it's 3 kilograms.
Okay.
Yes. And the temperature when you assessed him?
Temperature was okay. It was
Okay.
36.8.
36.8. And the heart rate, let me feel it. Okay. See, 150. Okay. And I see he's breathing a bit fast.
Just a little fast. I counted it. It was about 45.
45.
Yeah.
Okay. And I see he's pink.
Yeah.
He's clearly not dehydrated.
No.
And
He was feeding well before he started having this seizure like 24 hours ago. And for 24 hours, she said he hasn't fed well.
so he's not really fed well.
No.
So he's poor. And let me do the capillary refill time. That's normal. That's fast. So, and then he's not having any noisy breathing. Chest is not having in drawing,
No.
but is convulsing now. And
Should we call the doctor?
let's just, we can call him shortly, but let's first complete the management.
Okay.
So that by the time the doctor comes, we can be able to see what happens.
That's a good idea. So what does it say we do?
Okay. So we're going to give prisms a few seconds as
Okay.
it understands what needs to be done.
Okay.
So it says the baby is having poor feeding. We need to check blood glucose or give him IV 10% dextrose.
Let's give the dextrose because
Okay.
with the machine is not working for the glucose.
All right. So let's give him the dextrose. We've given him the dextrose already. But it says we should NG-tube feed him if he's unable to cup feed. But he's
He's still
convulsing
seizing.
now.
He's
Let's
still
see.
convulsing.
Let's do that later. So now, IV antibiotics. For convulsions, we need to give him 10% dextrose, which we have given.
Yeah.
And it says we should consider phenobarbital.
Let's give the phenobarb. I don't remember the dose.
I don't remember the dose either, but I think Prisms can help us. Let's click on this. So, okay, this is it.
Oh,
So
there we go.
Prisms is telling us to give 20 milligrams IV slowly
Okay.
over 5 minutes.
Okay, let's do that. Can you go
So
pull
let
it
me
up
do
while
that quickly.
I keep the baby? I'll keep holding the baby.
All right. So let me get my phenobarbital. I've mixed it. So let me give it in. Okay. So we're going to wait a little bit. Sometimes this phenobarbital takes some time too.
Oh, it's settling down.
Yeah.
Starting to settle.
Okay. All right.
What are we going to do now?
So let's see what Prisms tells us. Says the common causes of convulsions could be birth asphyxia, some infections of the brain,
Okay.
hypoglycemia, and hypocalcemia.
So we treated the glucose,
we've
right? We
treated
gave
the
the
glucose.
dextrose and it didn't stop. Should we give the antibiotics and then wait for the doctor to decide? It doesn't seem to.
Let's go back to the management. It says yes. It has infection signs, so we
Yeah.
should consider a complete blood count.
Yeah.
Blood culture, give IM or IV antibiotics.
Okay,
So I think you're right. We should give the antibiotics.
and then find out, and then we'll have to find out what the doctor thinks we should do because
Okay.
Prisms doesn't.
You remember what the guidelines say about giving antibiotics?
No.
Well, in Prisms, let's look again. Prisms, so say antibiotics is in blue, so which means it has additional information.
Okay.
And we click on there. So it says the treatment of neonatal sepsis. Always give a combination therapy. So IM or IV ampicillin, 50 milligrams per kilogram every 12 hourly, and IM or IV gentamicin, 5 milligrams per kilogram twice a day. Okay. I think that's what we should do.
So we can do that, but we still don't know what to do. I'm a little worried. Prisms is not complete.
So
they don't tell us what to do after that.
Yeah. So we've stopped the convulsion.
Yeah, and we'll give the antibiotics.
We've given the antibiotics.
And the glucose.
We've given the glucose.
Now what?
Okay. So,
what I should tell the mother?
Again, say, if oral feeding is not possible, give dextrosaline. But I think we can NG-tube feed the baby.
For now.
For now. But I understand, yes, there may be some things that Prisms does not really tell us.
Right.
Well, why can't we report to Martin some of our concerns about
Let's
Prisms?
do that. So next time we know.
If we think there's something that is missing, we can be able to talk to him and then see how the technology can grow.
Sounds like a good idea. So let's give the antibiotics.
Okay.
We're going to stop here, guys. Thank you very much.